How has the HPV vaccine evolved over time? The story of the HPV vaccine is a fascinating journey from scientific discovery to a powerful tool in preventing cancer and sexually transmitted infections. It all started in the 1980s when Harald Zerhausen identified HPV types 16 and 18 in cervical cancer tumors. This discovery proved that these viruses played a direct role in causing most cervical cancers, which was a major breakthrough. It motivated researchers to find ways to prevent HPV infections before they could cause harm. In the early 1990s, scientists Ian Fraser and Jian Zhu made a key breakthrough by creating virus-like particles, or VLPs. These VLPs are made from the proteins that, from the outer shell of the virus, called capsid proteins. They look like the real virus but contain no genetic material, making them safe and effective at triggering immune responses. This technology laid the foundation for developing HPV vaccines. They filed a patent for this in 1991, which helped move the research forward. The first HPV vaccine, known as Gardasil or HPV-4, was approved by the United States Food and Drug Administration in 2006. It protected against four HPV types, 6 and 11, which cause most genital warts, and 16 and 18, which are responsible for about 70% of cervical cancers. Initially, it was recommended for girls and women aged 9 to 26. Soon after, a similar vaccine called Cervical, or HPV-2, was approved, focusing on the two high-risk types 16 and 18. In 2009, the approval expanded to include boys and young men aged 9 to 26. This was a big step because vaccinating males helps reduce transmission and protects against other HPV-related cancers like anal, penile, and throat cancers. Over time, vaccine options have improved further. In 2014, Gardasil 9 was approved, offering protection against 9 HPV types. This vaccine covers about 90% of HPV-related cancers, by including 5 additional high-risk types beyond the original 4. Vaccine recommendations have also evolved. Now, vaccination is advised starting as early as age 9, with catch-up programs for older teens and young adults in some cases. The dosing schedule has been simplified too. For younger adolescents, 2 doses are often enough, making it easier for more people to get vaccinated. Researchers continue to work on improving vaccine formulations, delivery methods, and making vaccines accessible worldwide, especially in low-resource areas where cervical cancer remains a major health issue. Since the introduction of the HPV vaccine, public health has seen remarkable progress. Rates of HPV infections, genital warts, and precancerous cervical lesions have dropped significantly among vaccinated groups. The goal now is to increase vaccination coverage globally, especially in countries with high cervical cancer rates. Future research is exploring therapeutic vaccines that could treat existing infections and broader protection against more HPV types or related diseases. In summary, the HPV vaccine has come a long way from its scientific roots in the 1980s. It has evolved from a concept based on understanding HPV's role in cancer to a safe, effective, and expanding set of vaccines that protect millions of people worldwide. These vaccines are a key part of preventing sexually transmitted infections and reducing the burden of cervical and other HPV-related cancers. For the best protection, it is recommended to get vaccinated before becoming sexually active, but vaccination can still be beneficial later. Always consult healthcare professionals for personalized advice and stay informed about ongoing advancements in HPV prevention.